If you are about to start chemotherapy, I want you to talk to your medical team about these 3 things. Number 1, does the chemotherapy I am about to receive increase the risk of neuropathy, which is damage to the nerves in our fingers and toes, and neuropathy can lead to symptoms of pain, burning, tingling, changes in sensation, and then can progress to impact with gait and mobility. And if the treatment that you're about to receive increases neuropathy risk, I always like to make sure we are checking vitamin D, because there is some data that a low vitamin D level can increase neuropathy risk. So we would replete that if it's low. And then also talking to your team about cooling gloves or cryotherapy during chemotherapy, which has some data to reduce the risk of neuropathy. Number 2, does the treatment you're about to receive impact the heart? And if so, do you need an echocardiogram before you start treatment? This we see with treatments like anthracycline chemotherapy, anti-HER2 therapies, but make sure you've asked and know, if I need an echocardiogram, and then what is the cadence of that cardiac imaging going forward? Number 3, what is the incidence of hair loss with this regimen? Have you had a conversation about scalp cooling? I think scalp cooling can be remarkably helpful, although it is more effective for some regimens than others. It's really helpful to try to preserve as much hair as possible, and also can help the hair grow back faster once chemotherapy is done. Taxotere is a chemotherapy that has been very rarely but associated with permanent hair loss, so I always do think about scalp cooling when someone is receiving taxotere chemotherapy. And then as a bonus tip, make sure you know and ask about what pre-medications you're going to be getting with the chemotherapy, whether that's medications to reduce allergic reactions, whether that's medications to try to prevent nausea, and then what should you have at home in case you develop symptoms of nausea, vomiting, and other chemotherapy side effects. Let me know all of your chemotherapy questions, and then also any tips that you have for someone who is starting chemo.